7, 6, 5, 4, 3, 2, 1.
Oh, hey, I didn't see you there. I was busy on my phone. It seems like nowadays most everything can be done on your smartphone or on your laptop. For example, I'm pretty hungry. Maybe I'll get some tacos. I'm going to order them from my phone and have them delivered to my office in about 20 minutes. Maybe I want to get some new furniture for my house. I'm going to order that and have it delivered in 2 days. What if I were to tell you that the future of healthcare will be no different? You'll be able to access healthcare from your phone or from your laptop in the comfort of your own home, getting medical advice instantly. What if I were to tell you that the future of healthcare is now? Hi, my name is Matt Law with Health Benefits Associates. Thanks for tuning in to this week's episode of Hello Health, where we will be talking about virtual healthcare with Dr. Beatriz Ang-Ermocilla, who is a virtual healthcare family medicine practitioner. Now, before we get into it today, I want to talk about a few things. First off, if this is not your first time on Hello Health, welcome back. And for any new viewers watching Hello Health today, this presentation that we're doing is a live event. I'm talking to you in real time, and Dr. Ang-Ermocilla will be talking to you in real time as well. We're going to be talking about virtual healthcare today, but we also have some upcoming events starting next week through the Mastering Medicare series. Mastering Medicare is an educational event through YouTube Live that is done in real time and just in time for the annual enrollment period for Medicare. So if you want to learn more about which Medicare plans are right for you, tune in next week on the 15th. I'll be kicking us off and talking about the expert tips that you need to know to find the right Medicare Advantage plan. Now, this YouTube channel itself has a lot of videos like Hello Health, Mastering Medicare. We also have some informational videos and instructional videos on Medicare. So if you want to learn more about your health, I recommend hitting the subscribe button on our YouTube channel so you can be notified when we go live or have a video update for you. Now, I know we're talking about virtual healthcare today, and obviously we're talking to you through YouTube today. But if you want to come and ask us questions in person, Health Benefits Associates has offices in Reno, Sparks, and in Carson City, where you can come face-to-face and ask us any healthcare or Medicare questions that you have. Coming back to this segment for today, which we're really excited to learn about, since virtual healthcare is on the rise, and that's not all due to COVID-19. Virtual healthcare has been on the rise for quite some time. And if you have any questions for Dr. Ang-Ermocilla or myself, please ask those questions in the comments section below this video, and we will get to your questions with answers in real time at the end of the presentation. So make sure to stay tuned until the very end. Now, enough about the channel and the video today. I want to get into the topic, and I want to hear more about virtual healthcare. But first, let's introduce Dr. Ang-Ermocilla. She lives in Vegas, but she might as well live down the street from you, since you'll be able to access her healthcare services through your phone. She's been specializing in family medicine and practicing for 15 years in Nevada. But today we're going to hear about her new specialty and what she is really focusing on, which is virtual healthcare. Now I'm going to kick it off to her, and I want to make sure that she is tuned in. Dr. Ang-Ermocilla, can you hear us?
Yes, I can.
Perfect. Well, I think we're all geared up and ready to learn about virtual healthcare, so take it away.
Thank you. Good afternoon, everybody. Thank you for the wonderful introduction, and thank you for inviting me to this wonderful series. As Matt said, my name is Dr. Beatriz Ang-Ermocilla. I have been practicing in Clark County for about 15 years, and currently I'm with Access Primary Care Physicians, which is a part of the Alignment Health Plan Network. I specialize in family medicine. I'm really excited here today to be talking about virtual health. Um, you know, virtual health, as we all know, it's actually been around for about, I would say, maybe like 10 years. It's been kind of out there for the last 10 years, but it really didn't take a hold until last year with the pandemic. And so when the pandemic happened, you know, the healthcare system just struggled to meet and to or to respond to the demand with any kind of appropriate resources. So then, virtual health was put front and center. And in an outpatient practice like mine, where we really don't see any kind of emergency cases, this has been such a valuable tool because it has allowed us to reach out to our patients who do not need emergency care just to discuss their day-to-day concerns or things that might, come up, or to follow up or to check on their sugar or follow up on labs, things like that. So I have been doing virtual care consults since when the pandemic started in March of 2020, but most recently through Alignment Health Plan, the AVA plan, which is here in Clark County. It is a plan that caters to seniors where we provide 24/7 access to care with, your primary care physician, the virtual team that includes, a variety of support group like your medical assistants, social worker, things like that. And from my experience with doing virtual care, I say that it does work. It does definitely have a role, and I think it's here to stay. Um, when you have, you know, options to give patients in terms of how they get their care, it's always a good thing. And in 2020, back when the pandemic started, there were only 15% of outpatient practices that offer virtual care. In contrast to now, in 2021, I would say maybe more than 90% of the practices now offer virtual care in as part of their daily visits. So, what exactly is virtual care? Like, what does that mean exactly? So, virtual care, telemedicine, telehealth, essentially they all encompass it's a term that really means that you are interacting with, a patient and a healthcare provider that is done remotely through live audio, video, or even by email. So this includes, when you want to follow up after, let's say, an in-person visit, or to check in after like a procedure, for example, like an outpatient surgical procedure, or if you want to just kind of have like a blood pressure check and just kind of follow up if you started a new medication, say, hey, how's my blood pressure now after starting this new medication, things like that. And it's also a great way to, if you have questions to your providers about your diagnosis or what medical conditions or treatment plan in particular. Sometimes, like, we've seen cases where we see the patient in the office and then they go home and the family member will ask questions and they don't remember. And so it's a great way to also be in touch with the family member so you can discuss what's going on, and be more specific about the care plan and things like that. So you can involve everybody and get everybody engaged that way. So, why is virtual care an important topic right now? So, the answer really, like, there was a poll that was conducted by the Better Medicare Alliance in 2020. 91% of seniors who have done virtual care had very favorable response to it. And out of those poll of seniors, 78% are likely to book their follow-up appointments through another form of telehealth in the future. Now, in another poll, out of the seniors that did telehealth, 76% would recommend the same for a friend. So as you can see, there is definitely a role for virtual healthcare in this day and age. Now, virtual healthcare definitely helps increase access to care, especially for our seniors who are either not able to drive or who struggles to get out of the house because of they have to be on a walker or a wheelchair, and if the family member is working, then this is a way to reach out to them and make them um, have that control over their care. Depending on where we live, sometimes we have to travel a long time to get care to see our provider. So virtual care definitely makes it easy for us to do routine visits or any kind of non-emergency discussions can be done over the phone. So what we see is when through experience when seniors or patients in general that who cannot reach their physician or who cannot get to the doctor's offices, what ends up happening usually is, they will go to the urgent care or the ER. And we really don't want that because, for one, if you go to the urgent care or the emergency room, you are bound to be there for long hours. And it's just something that you don't want to do. The longer you stay in a place where it's very congested, then the more exposure you get to any kind of infectious disease like the COVID that's going around currently. So sometimes also, like, if you're not sure if do I go to the ER, do I stay home, and that's also a good way to connect to your provider, to your healthcare provider, where you talk and say, hey, I have this condition, what do I do? Do I should I go to the ER? So it's a good way also to have that decision making. And then because of that, it helps because then there's this reduction in overcrowding in the emergency room or urgent cares, and also there is no wait time. I think that's the best part of it. No travel time, no wait time, so easy access. Now, we know that technology can definitely build the gap for patients, especially our seniors, when so you can see a physician by phone or video. Um, Technology, I think, if we put it to good use, it definitely can help keep our patients healthier, um, stay at home, and stay as independent as they age. And also, it helps you. It just makes you feel more confident seeking care and taking control of your health and seeking care that way. It's very empowering for patients. They can manage their health and again be independent. And it also can help families in a number of ways. So I mentioned about we reduce the burden of transport or cost of travel expenses. We also have seen that it has cut down the number of unnecessary hospital visits or helps reduce the stress on the caregiver. Um, and again, like I said, sometimes like when you just want to talk to your provider and say, hey, I'm not sure what's going on with me, but this is what's happening. Am I able to just, take something? Can you call in something for me? Or this is something that needed a higher level of care. So those things can be discussed virtually as well. So it's almost like, you can pre-screen, or I can help pre-screen my patients, and then I can give them advice whether, okay, this is something that we can definitely treat, and I'll recheck with you in a few days, or it's something that, no, this is something that would need a higher level of care. So I would recommend that you have somebody, or have somebody, or call 911 for some things. So one of the things that in this day and age that we always worry about is the spread of infectious diseases. And so being at home in the comfort of your own home in your living room, we we are able to avoid that exposure through virtual care. And we also protect the our family members, our immediate family members who are with us, like if you have a pregnant family member or somebody who is immunocompromised or somebody who has a lot of health issues, so that helps a lot as well. Um, so I would say overall, technology can definitely improve patient health and well-being. Um, you can get your diagnosis, you can get treatment options, you can discuss it in great detail with your healthcare provider at home. And of course, there's always that thing where, you know, with technology, how do you like, most of my senior population will always ask me like, "Oh, I don't know how to do that. Oh, you know, I don't know. I don't even know how to text." But really, they've made it very simple now. And if they are in the clinic, sometimes before they leave, I'll show them what it entails, which makes it very, very easy. And it gives them that confidence to say, "Oh, I just need to click on this, and it will turn into a video call." I said, "Yeah, I know." So things like that. So when is it right to use virtual care? So for many of us, virtual care really has been used as a safety precaution due to the COVID-19 pandemic. So instead of traveling back and forth to a clinic or a hospital or any kind of healthcare facility, then you are just able to connect with your physician by phone or video for non-emergent or minor health problems. So you may want to ask, like, but what kind of minor problems, can be taken care of virtually? So, things like I've done virtual care on bladder infections, sinus infections, migraine headaches, for example, allergy symptoms, things like that. Or sometimes if patients like fell and the family just want to discuss about what to do because after the fall the knee is hurting, things like that. So we can um, always connect through virtual care and address those concerns as well. Of course, if you have concerns about, if you are immunocompromised, if you have a lot of chronic medical issues and you just want to stay home because you don't want to be exposed to infectious diseases like we talked about earlier. And another great way to do virtual health is, for mental health counseling, for example. So mental health evaluation and counseling. I know a lot of the psychologists, counselors, and psychiatrists are now like using the video or virtual care platform. So that's also a great way to address those concerns without having to leave your office, and it's also more efficient. Um, and I think that's all I have for you. Do you have if you guys have any questions?
Yeah, and that was a great presentation. We actually have a lot of questions coming in, and I'm gonna ask you these questions so we can get answers to our live audience today. But before we do, if you're watching
Of
today and
course.
you like today's topic, or you like Hello Health in general, make sure to like the video on this YouTube channel so we can bring you more content like this in the future. And I'm sure that Dr. Ang-Ermocilla would love to present more about this, maybe for a part 2 Hello Health series. But let's get back to today's topic, which I'm seeing some shout outs and some questions in the Q&A. I'm going to kind of troll through this and just shout them out so we can get some answers. First off, Matthew says hello. And hey, it's good to, I'm glad that you're tuned in. So thanks for tuning in today. Our first question is coming from Envy Native 123. I usually like to go in and see the doctor face to face. Are there benefits to doing it virtually?
Well, if just because you have a virtual care platform, it doesn't necessarily mean that you cannot request to see your physician face to face. And so it really depends on circumstance. Like I mentioned, like one of the great thing about doing virtual health is if you are in need of care for one reason or another, and you have limitations because you cannot travel or you cannot go to your physician's office because of work, for example, or you just don't have the flexibility. So that's where virtual health comes in. But if you're able to go to the physician's office and you prefer that, that's also great.
Well, the other thing that I heard, and Envy Native, this actually, a few things stood out today in today's presentation, is that 91% of seniors doing virtual visits say that they had a great experience. So, yeah, the face-to-face is always good, but it sounds like virtual healthcare, if you haven't tried it, you may want to, because there's shorter wait times, you may be getting the same healthcare services rendered, and you're probably going to have a good experience doing it. So, for anyone who wants to look at scheduling a virtual appointment, Dr. Ang-Ermocilla's contact information is in the description of this video, so you can always reach out and schedule an appointment with her. And I hope that you get as great of an experience with her as we are today with all of you watching Hello Health. Now, a few more questions. This one's coming from Amanda. I don't really understand my health insurance plan. How do I know if I'm eligible to do a virtual visit? Amanda, there are a lot of different health insurance plans. Really depends on what you have. So if you need help understanding what your coverage includes, especially for virtual visits, you can contact us off air and we'll help you with that. And our contact information is also in the description of this video. The next question I'm seeing is, it sounds like Envy Native was having some login issues today on YouTube. I don't do computers very often. So how hard is it to do a virtual visit?
It's really not hard. So keep in mind that there are different platforms that, we can switch to. If, for example, like, it's always, I think it's always, I always prefer to have like a video call, because I like to have that interaction with my patients. But I've done virtual visits before where, for whatever reason, because sometimes, like, if you live in a neighborhood where the Wi-Fi is not so good, for example, and you're not connecting very well, then we'll just switch over to either a phone video, of like a phone call, like just an audio visit, or sometimes I will have patients where, like, why don't I use my husband's phone, because his phone is a newer model and it seems to be working better. So we've done so. It's been flexible, and again, like I said, it sometimes you don't get it right the first time, but again, we just keep trying, and the technology is getting better as well, so it gets easier.
Yeah, and technology, it seems like every day there's a new phone that's coming out or a new laptop. So, if you think healthcare is accessible today via virtual care, I mean, think about it. 5 years from now, maybe we'll be wearing, some special glasses. We'll be able to see the doctors through our sunglasses. Who knows? And I actually have a question myself, coming back to the actual hardware of this stuff, because this stuff really fascinates me. I am 31 years old, but I'm glued to my phone all the time, and so I'm kind of wondering, so if I did a virtual appointment with you, would you be mailing health equipment to my house, or would I be using like a smartwatch or something to get different readings to you? How would I do that?
No, it's not. It's not that complex. So currently, under the Ava platform, if you are part of that Ava platform, it's really more like you just log into this site, and then that will have your, there's you will just ask you to enable your audio and your camera, and then you're good to go. But also, if you have a smartphone, normally what we would do in some cases is we will send you a text message, and then when you get the text message on the phone, it's actually a link, and really all you have to do is to click on the link, just like you're opening any kind of text message. When you click on the link, and it will just ask you, like, would you like to allow camera use, and you just say yes, and then once you click yes, it will take you right into, they call this like a virtual waiting room. And then once you're in the virtual waiting room, I can see on my end that you're waiting, and then all I have to do is click, and then we see each other on the video, and then we start the visit.
Wow, that's incredibly easy. I feel like it's more complicated to order a pizza on my phone than it is to schedule an appointment with you. So that's awesome. And it sounds like it's easy to do, but I don't have to wait that long to do it, which I feel like that is the biggest concern I hear from people in Nevada, is that just getting into a doctor can take months, and it actually can be complicated just to see a doctor in person. But sounds like the exact opposite with virtual healthcare. So that is
Yeah,
good.
there is a shortage of. Um, oh, I'm so sorry. I couldn't hear you well.
Oh, yeah,
There
no,
is a
continue.
shortage of physicians in primary care in Clark County for sure. And one of the great things about virtual care is you're able to do more visits, um, virtually, and at least like especially like if you have a patient that during the day when you have scheduled appointments, and then somebody will call and say, hey, my grandfather fell, can you get them in? And it's already late in the afternoon, and if they have to travel, they're not going to make it in time for the clinic to close. So then you just switch them to virtual, and then you're still able to take care of them.
Yeah. And I've personally used virtual care on my own insurance plan before. I actually had a herniated disc last year, and I just could not actually get out of bed. So it was a relief to talk to someone and get advice and actually get pointed in the right direction. So always make
Right.
sure, or something I always say to my clients is, virtual care is like having a doc in your pocket. It's a doctor in your pocket, and it's really convenient and easy to use. A few more questions before we let you go. Looks like Bethy has a handful of questions. Can anything be treated with virtual visits, or is it just simple stuff? Can I use it for emergencies? So what are the limitations with virtual visits?
So the limitations for virtual visit is always if you have an emergency. But we always have to put things into context, right? So like I have an idea of who my patients are, how they do. Like for example, if I have a patient with COPD and I've known them, I've been treating them for a while. So if they call me and say, I have trouble breathing, I'm not as alarmed because I know that they've had COPD for a while, and it's just a matter of asking the questions. So 80% of your diagnosis, you get it from asking the right questions. What matters, what's important, so that you kind of figure out like, okay, this is something that we can treat. But like if somebody calls me and say I'm out of breath, and I know for a fact that that particular patient never had any kind of respiratory issues in the past, and now I can hear from the tone of their voice, or I can see them when we're talking on the camera that they are really struggling to take a deep breath, or if a family member calls me and say, my grandpa, for whatever reason, he's been sleeping and this is not him. And I know that, for example, that particular patient, I know him that he's an active person. Then those are the things that I will definitely advise. Like you have to go to the emergency room. But for like routine non-emergency care, like you said, like a herniated disc, you would think that it can be an emergency in some cases, but it can also be done through virtual care as long as you don't have the alarm symptoms that we look for when we ask the history.
And that's good to know, because it sounds like maybe there are definitely day-to-day proactive appointments that people can take, but maybe in a pinch, if someone needs just some quick medical advice on if it's an emergency or not, maybe they contact you and they're able to segue and figure out if they should be going to the ER or if they should just be scheduling a follow-up appointment with you for a non-emergency care treatment. Is that right?
That's correct. So we've had calls like that where like some like today, for example, I just had a call about a patient of mine. She was in the ER a couple of days ago for leg swelling, and everything came out good on her test, but she's still not doing well. So she called and say, hey, I'm supposed to follow up virtually, but can I just go to your office because I'm concerned that my leg is still not better? And I'm like, sure, just come on in. And so there's always that flexibility, and it's just a matter of understanding the needs of your patient and then just meeting their needs where they are.
Awesome. Well, it sounds like you do it all, and you can do it all for the most part virtually, and you can keep it simple for people who want to schedule an appointment with you, which is awesome. I think
Correct.
we are out of time for today on the Q&A. I do see a few other questions that we didn't get to. And as always, if you have questions, you can leave them in the comment section below this video, and I will reach out to you directly with an answer from Dr. Ang-Ermocilla. And with that, I want to thank you for today's presentation. We learned a lot. I learned a lot. We hope to see you again in the future.
Thank you all.
Thank you. Now, I had a lot of fun today with today's presentation, and I definitely learned a lot, especially since I am always glued to my phone. And the thing is that we have a few more presentations coming up here just in the next week. In 2 days from now, on the 9th, I will be back invading your YouTube space by interviewing Dr. Kent Sassy with Sassy Surgical Associates, and we will be talking about incontinence. So make sure to tune in at noon on Thursday if you want to learn more. And as a reminder, we have Mastering Medicare, an educational series that will be going live next week on the 15th, and we'll be taking a deep dive into the expert tips and tricks to find the right Medicare Advantage plan during the upcoming Medicare annual enrollment period. Now, if you liked today's video, or if you want to learn more about these Mastering Medicare events or in-person events that we're hosting, you can click on the link in the description below this video, which will take you to our website with a full schedule of topics, dates, and times. So with that, my name is Matt Law with Health Benefits Associates, and I'll see you in a couple days.